Hi, I'm Dr. Vybhav Deraje. I'm a plastic surgeon at Aesthetica Veda, Bangalore. Today we're going to talk about some of the complications of tummy tuck procedure. One of the most common complications that we see after a tummy tuck procedure is some wound healing issues in the scar. See, this can happen to anyone in spite of the best efforts by your surgeon and you in taking care of the wound. Some amount of wound dehiscence can happen in the middle of your wound because of the extreme tension that is there on the scar. So we always ask you to actually bend ahead and walk for the first 1 week to 10 days after tummy tuck procedure to avoid this complication. But still, in some rare circumstances, this can happen and it might require some dressings for those wounds to heal. One of the other complications that we see sometimes is infection. Infection also can happen to everyone. We usually provide some prophylactic antibiotics and some antibiotics for you to have post tummy tuck procedure as well. But still, in less than 0.5% of the times, some people can have some minor infections, especially at the wound site or the umbilicus or the belly button site, which needs to be treated by some stronger antibiotics. One of the rare complications of the tummy tuck procedure is a difficulty in breathing or due to extreme tension, something that we call as an abdominal compartment syndrome. Now, we usually never go so overboard in tightening your abdomen that this should happen, but it can happen in people who have had extreme visceral fat. If your belly has been really protuberant and if your belly was completely filled with fat which was making your belly a lot more bulgy, this is a potential that can happen because we are putting back all the fat into your abdomen and tightening your abdominal wall. So that can put pressure not only on the lungs but also your other blood vessels, causing something called as an abdominal compartment syndrome. This is extremely rare, but it can happen. So this is where patient selection is extremely important. Now, many people ask us, am I a candidate for tummy tuck? Can I go ahead? Most of our patients are decent candidates for tummy tuck, but there are some people who have extreme medical comorbidities, especially some breathing issues, respiratory problems, restrictive pulmonary diseases, uncontrolled diabetes, and these kind of patients are not candidates for tummy tuck operation.